Hi, welcome to the State Capitol. This is where you'll be on Disability Day on the Hill, and we're excited to think about having all folks with disabilities and their families and their allies coming downtown to Nashville to talk to their legislators to really make a difference in the lives of Tennesseans who have disabilities. I'm Carol Westlake. I work with the Tennessee Disability Coalition, and we are looking forward to having you. This little virtual presentation is a way to begin to prepare you for Disability Day on the Hill. Public policy affects all of us in many, many ways, whether it's healthcare, education, transportation, or employment. And we want you to think about those things and think about the things that matter to you and how public policy impacts that on your way to this preparation. DDH is a great time to begin to build a relationship or to continue a relationship with your senators and representatives and to really make sure that they're educated about those things that are important and understand the impact of their work. So think about your life, think about the lives of the people around you, and the kinds of issues that are going to be important to you. There will be specific policies, specific bills that we're going to talk about a little bit as a part of this presentation. But overall, the real important thing is for you to be able to tell your story and talk about the issues that are important to you. One way to think about those issues is to go to the Coalition's website and take a look at our public policy platform. This covers a broad number of areas in public policy where the state has a role in making sure that they are passing enabling kinds of policies that really make a difference in people's lives. And that'll help you get prepared, I think. Another way to get prepared is to make sure you know who your legislator is and know a little bit about them, and perhaps some of the policies that are going to be that they're going to be addressing this year. So the best way to do that is to go to the state's website. The General Assembly has a website where you can put in your zip code and it'll tell you who your senator is and who your representative is. There'll be pictures there, you'll see what committees they're on, it'll talk a little bit about their background, so you'll have something to talk about if you don't know your legislator well when you get there. That's also a place to go and look at bills. You can search by subject, so if there's something that's really important to you, put that subject in. You can see the kinds of policies that are going to be considered this year during the General Assembly. This is the first session of a two-session assembly, and that means that not all the bills that are going to be addressed are going to be on the website when you go there before DDH, because the bill cutoff is February 9th. But there'll be a lot of things there that will really give you a sense of the work of the General Assembly and the kinds of things that they're doing.
Hi, I'm Emily Hoskins. I'm a former U.S. Paralympian for women's wheelchair basketball. I now serve as head coach of the Music City Thunder, and we're part of a local organization called Able Youth. Able Youth works with kids with disabilities through sports and recreation. Disability Day on the Hill is important because it's a chance for people with all types of disabilities of all ages to speak up to their legislators about the things that they are passionate about and the things that they need. We need to fight for and raise our voice for access to things like healthcare, education, transportation, employment, and everything in between. So use this opportunity to raise your voice. Let your legislators know about what's important to you.
Hi, my name is Sarah, and today I'm going to talk about policy issues of note to help you prepare for Disability Day on the Hill 2017. First, let's talk about the Tennessee Autism Council. Autism spectrum disorder is a developmental disability that causes significant social, communication, and behavioral challenges. In 2014, the Centers for Disease Control and Prevention released new prevalence data indicating that about 1 in 68 children are diagnosed with ASD. ASD impacts all communities, all ages, and all socioeconomic classes. Nearly every state agency is impacted by this growing condition. In November 2015, the Joint Legislative Task Force on Autism Spectrum Disorder adopted the recommendation to create a home in state government to assist interagency coordination. This year, introduced at the state legislature, is Senate Bill SB 199, which would create the Tennessee Council on Autism Spectrum Disorder. This council would consist of several state agencies and 6 individuals impacted by autism. The council would assess the current and future impact of ASD in Tennessee, assess current programs and services in state government and through providers, and coordinate among state agencies to develop a comprehensive statewide system of care. The coalition is very supportive of this legislation. Another piece of legislation introduced at the state legislature this year regards health maintenance tasks. Health maintenance tasks are those that people would ordinarily perform for themselves, for which they may need assistance because of a disability. Examples are putting in eye drops or taking one's blood sugar. These are tasks that family members and friends who have no professional training perform for their loved ones every day in their own homes. Paid personal assistants cannot currently help with these tasks. Therefore, if a friend or family member is not available, a nurse is required to come to the person's home. This is not often practical, affordable, or sustainable. Legislation introduced this year would allow the person or caregiver to direct and supervise a paid personal aide to perform health maintenance tasks if the person's treating healthcare provider determines that it is safe to do so and trains the aide. This is a bill the coalition, again, is very supportive of. Another piece of legislation introduced this year regards non-medical switching. Non-medical switching is the practice of compelling a stable patient to change medications for reasons unrelated to his or her health, often driven by health plan design or policies. In Tennessee, there are currently no protections that prevent health insurers from reducing coverage of medications even after a consumer has signed on to an insurance plan. Mid-year benefit changes are fundamentally unfair to all consumers, especially those who carefully select a plan based on its original terms. Even worse, however, mid-year coverage changes can actually be unsafe. Increases in drug costs often force patients off of their originally prescribed treatment, causing increased symptoms, side effects, and even relapse. This disproportionately affects individuals with chronic illnesses. The Tennessee Coalition for Patient Stability, made up of both patient and clinician advocacy groups, and of which the Tennessee Disability Coalition is a member, is putting forth a bill that asks Tennessee lawmakers to ensure that consumers can count on the pharmacy benefits they are sold and prevent non-medical switching. In Tennessee, there are about 8,000 Tennesseans with intellectual, developmental, and age-related disabilities who depend on home and community-based service providers. The direct support professionals in community agencies provide the foundation for community living. They ensure the health, safety, and well-being of people with disabilities by providing daily personal care, teaching life skills, and supporting people to be actively engaged and working in their community. Today, home and community-based service providers are experiencing a 46% turnover in direct support professionals, causing a provider workforce crisis. This is due in part because the state of Tennessee is only allowed to reimburse direct support professional salaries based on a set methodology of $8.73 an hour. This figure has risen just 48 cents in the last 10 years. More competitive wages are needed to serve our most vulnerable population. We are asking that the 2017 budget include a $1 an hour increase in the Department of Intellectual and Developmental Disabilities rate methodology for all residential, personal assistance, day, and family-based services funded by the state. This would provide funds needed to increase DSP wages. Our final issue today to discuss is a federal issue that impacts all Americans, including Tennesseans. On the national stage, there are proposals to turn Medicaid into a block grant program. Now, currently, TennCare is our state's Medicaid program that provides healthcare for approximately 1.5 million Tennesseans. Currently, the federal government matches state funding for TennCare at about a 3-to-1 rate. Funding for these services rises and falls according to actual state costs and needs. Under a block grant plan, federal spending would be set in advance and capped. States would be responsible for all Medicaid costs in excess of the federal cap. Block grants are typically established based on a state's current or historical spending. Historically, the amount allotted to states for progressive years is increased at a considerably slower rate than actual increases in healthcare costs and the need for Medicaid services as our population ages. The result is an increased burden on states, and fewer Americans are able to receive needed services. To compensate for the federal Medicaid funding cuts a block grant would institute, states would either have to contribute more of their own funding or, as is far more likely, use the greater flexibility the block grant would give them to make dramatic cuts to eligibility, benefits, and provider payments. It is very important that we educate our lawmakers about how harmful Medicaid block grants could be. Thank you for listening today. I'd like to remind everyone that on our website at www.tndisability.org, we have fact sheets on all of these issues.
Well, I hope you found this presentation helpful and that you're feeling a little better prepared for Disability Day on the Hill. We look forward to seeing you at Legislative Plaza. You can come down and come through. We'll have a table, we'll have maps to get you to where you need to go, volunteers to assist you if you need, and many, many materials that'll help you on your way to visit with your legislator and to really make a difference. See you then.